overwhelming it is. It's an awesome turnout. I'm really excited. I just want to give a special thanks to the James Madison Student Senate who spearheaded this event, and the MSU College Gems, the MSU Republicans, and MSU Students for Choice who co-sponsored it with us. I would like you to all warmly welcome our moderator, Professor Zersky, and our 4 amazing panelists.
My name is John Freeman. I'm the Michigan State Director of 2 organizations. One is called Protect Your Care, which is a 501c4 organization. And I'm also the director of the sister organization called Know Your Care, which is a 501c3 organization. This falls under the rubric of a purely educational event, so I'm here with my Know Your Care hat. I've been involved with healthcare since 2007. I was involved with an organization to help build political support for the passage of the bill, starting in 2008, leading up to April of 2010. And then since the bill became law, I've been working for a different organization to educate the public in various constituencies. My 2-sentence statement is this. We have been attempting to get healthcare reform since 1935 in what I would consider the modern era. This is the most historic legislation and the most historic law this country has seen probably in 30 some odd years since 1965 when Medicaid and Medicare were enacted. This is fundamentally going to change young people, middle class people. It's going to help the United States' economy to be able to compete worldwide, and it's going to help all of you to be better able to chase your dreams in the future. And I'm a former state legislator as well. I just want to acknowledge his boss, Jim Marleau, because even though he doesn't want to make a political statement, I will. That as a Republican, he took a difficult task in trying to provide leadership in the state Senate about establishing the exchange in Michigan. And he was up against a lot of very conservative opposition, which I think, frankly, is misplaced. And so I just have a lot of respect for Jim Marleau for the role he has done to try and move healthcare in this state.
I'm Larry Martin. I'm a professor of economics here at Michigan State. I may have seen some of you in class over the years. And as far as the Affordable Care Act, I'm an economist, so what I'm really interested in is the economic problems with healthcare and the health insurance market that it was designed to correct, and its prospects for success and the incentive effects it might have on the performance of the healthcare and health insurance markets and effect on the distribution of well-being, those kinds of things that economists are typically interested in.
I'm Tom Platt. I'm internist, physician, chief medical officer for Cheery Street Health Services. The name isn't quite right on the flyer. Cheery Street Health Services, that's right. And come from Grand Rapids. Cheery Street Health Services is a federally qualified health center. And I'm not sure if everybody understands what that is, but there are community health centers around the country that get special grants called a 330 grant that provides funding for us to get care for people who would otherwise not be able to get care. So primarily people with Medicaid, people with no insurance, but we also see people with regular insurance as well. So Cheery Street Health Services is actually the largest FQHC in Michigan. We serve about 60,000 patients. But there are centers throughout Michigan that take care of the poor, et cetera.
Well, maybe we should just go down the row, and I'd say maybe we should know what are the 2 or 3 most important things we should know about the ACA, and especially how it works in Michigan.
First of all, I want to say I'm not an expert on the ACA by any stretch of the imagination. I probably know more than the average people. I do know how it affects our particular population. But the other thing I do want to stress that the ACA didn't start October 1st. This dates back years. Okay, so things have been occurring over time. The most dramatic change occurred October 1st, and it will happen January 1st when people actually get the coverage. And that's what everybody's focused on right now. But there are many other aspects to the ACA, such as being on your parents' plan until you're age 26, pre-existing condition exclusions, reducing the lifetime caps on certain services. So there's a lot of things going on. However, the most important aspect of it is getting people to have some type of insurance coverage to get care that they would otherwise not be able to afford or not be able to get. The type of patients that I see, and we will see anybody whether they have insurance or not. But even if we see them, they can't always get the medication they need, If they need to get specialty care, they can't get the specialty care. So the opportunity to get some type of coverage that allows them to get services that they need outside of primary care. But I would like to echo what Ryan was saying in terms of patient responsibility, that there does have to be some responsibility on the part of all of us, you, me, in terms of how we lead our lives. You know, if we're not going to be making healthy choices, then there should be some penalty or something that causes us to want to make better choices as we go on. And again, the Affordable Care Act, it's very complicated in many respects, but bottom line is to get more people insured and help them to make healthy choices.
How many people are actually familiar with the Act? I mean, a show of hands. Okay, so we don't need to go over it like we did last year, but I do want to point out on the back side of my first sheet, I put together a quick summary of what I would consider all the key provisions of the Act. And Dr. Platt touched over two of them, which I think need to be stated real quickly as part of my 4 points. The first one is young adults. Under the old, I mean, they're both absolutely right. We need to get young people to sign up for insurance. But the law has been changed to facilitate the ease of doing that. Under the old system, if you were on your parents' policy, that ended when you turned 18. And so young adults had basically 3 options. One, if you went to a university, most universities offer health insurance, but it tended to be expensive and not that great. And so, you know, some students would buy it, like my parents bought it for me when I went to U of M. But if you didn't have that, and then you had to go to option B, which is go without. Or if you got a job and your employer at age 18 or 19 offered you insurance, you were fine. But many employers don't offer health care for new entry, you know, new level people. So that was a problem. And then, of course, if the place you went to work didn't offer insurance, you're out of luck. If you're out of luck under the old system, you had the individual marketplace to go to, which is by far, as he will probably speak to, the most expensive under the old system. So one of the fundamental ways the ACA is going to help young adults is, as Doctor mentioned, you can now remain on your parents' policy to age 26. And it doesn't matter whether you're married, it doesn't matter whether you live with your mom or dad, it doesn't matter whether you live in Michigan, and it doesn't matter whether you have another job. These are all options that are out there to enable young people to remain on their parents' policy. So what that means is, and this goes back to my first point about chasing your dreams, you can graduate from Michigan State and you can go with your couple of friends and start your own new business, kind of like what Steve Jobs did way back on the Apple days. You know, not having to worry about health care, assuming you're on your parents' policy, means that you don't have to worry about one of the biggest overhead items in starting a small business, which is providing health care. So this is a wonderful thing. Second point, under the ACA, there's no more legalized discrimination against people with a pre-existing condition. This is huge because we all know people that probably have diabetes or have a heart condition or have some type of ailment that through no fault of their own, they inherited through genetics. Under the old system, insurance companies were allowed to legally discriminate against people by not having to offer them insurance. This law changes all that. The law kicked in a couple of years ago preventing discrimination against children, and now beginning in January 1st, there's no more discrimination against adults with a pre-existing condition.
We have to change the culture, because just changing the insurance is not going to change it. Changing the culture and the economics, there's motivational behavioral economics. I'm sorry, behavioral economics, where if you pay somebody, for example, they need to take their blood pressure medicine. Make sure they take it every day. Okay, you give them $5 if they do that over the course of a certain amount of time. Well, that they see that $5, that's very meaningful to them. That, okay, well, I can do that because I'm getting the $5. Where, on the other hand, if you say, okay, overall, you're going to get a tax refund next year for the same behavior, that doesn't mean as much to them. So the immediacy of it makes it very important. So how you incent the patient is very important, and it's really changing the culture of what we do. I mean, we know that we've got tremendous problems as far as dietary choices here, obesity, lack of activity, kids are not getting the exercise, we're cutting out school programs, physical education because of the economics. So there are many things that go into this, not just the insurance part of it, but the insurance is one aspect of it.
Interesting me is what problem was the ACA designed to fix? And that's the problem of health insurance for people who are not associated with a large employer. Most Americans get coverage either through their employer or through Medicaid or through Medicare. And the healthcare delivery works reasonably well for all of these people. But it's the people who didn't have the opportunity to get insurance through their job or through these large government programs who were then thrown onto this market now. You know, I spend my life praising markets. What was wrong with the health insurance market? Well, it's designed to insure, and it didn't really insure. So you have people who have conditions that maybe they have diabetes, maybe they have heart issues, and other people who don't. And so, as a good business practice, insurance companies want to find the ones who are relatively healthy because they're relatively low cost. And so they want to deny coverage or raise the cost of coverage to people who have those pre-existing conditions. So you can either allow them to discriminate or not allow them to discriminate. And some states ban that kind of discrimination, but then you're subject to kind of a free rider problem. So the person who has diabetes and needs treatment, or has pre-diabetes, can wait and not buy the health insurance, and then when the condition gets acute, go ahead and buy it. And that's just a recipe for disaster. And that's called the adverse selection problem, if you may remember from one of your courses. The solution to that problem is the solution that we use for automobile insurance or Social Security, which insures you against the risk that you would outlive your wealth, or other forms of social insurance, is just to make it mandatory. And so if you make it mandatory, then you can prevent insurance companies from discriminating. But it's a complicated program, and it's subject to political influences, and it remains to be seen how a lot of the things will work out. There are also some disincentive effects, and it will not affect everybody the same. So it has distributional implications. Social Security, for example, is a great deal for low-wage people, and it's a lousy deal for high-wage people. So it redistributes, and the health insurance system will do the same. I think it will redistribute to a particularly deserving group who have been pummeled over the last 40 years, and that's working class people. But I think some of the other things, it remains to be seen how they will work out. We do have some evidence from Massachusetts. We have some evidence from a very interesting experiment in Oregon. So we have some thoughts about what the likely outcomes are, but it's going to be interesting to see.
So now you can actually download 2 or 3 of these proposals, put them on your kitchen table, and you can actually compare them quite easily. So the idea is to create a competitive marketplace. And the reason why it's going to be competitive is that if you go on the exchange to buy insurance, you're eligible to get a federal tax credit. And the limits are pretty high. For a family of 4, it's about $92,000. We have about 1.4 million people in Michigan without health insurance. 400,000 will be eligible for Medicaid, which is relatively low-income people. But the 1 million people that don't have insurance in Michigan, I would argue, are probably middle-class people. And they probably make less for a family of 4, $92,000 or less. So all of these individuals and families will be eligible to get a federal tax credit. And so the insurance industry has a huge incentive to market their policies on the exchange to try and pick up a chunk of these 1 million more potential new customers. And that's why we're going to have a competitive marketplace, because they're going to keep their prices low enough that they're attractive to people that may want to pick them up. My two final comments real quick. You know, there is a lot of controversy about the Affordable Care Act. A lot of it comes from the right wing in this country. One of the many ironies of this is that Mitt Romney, the last nominee for President of the United States, he enacted essentially the exact same structure in Massachusetts, whereas you obviously know there are a lot of young people there. It has been incredibly successful in Massachusetts. They have now a 97% insurance rate in Massachusetts. It's very popular there with both individuals and the business community. Now, the reason why Mitt Romney pushed this idea in Massachusetts is because the Heritage Foundation back in 1989, which is a very conservative think tank, they were the ones that first put forth this structure of an idea. So Mitt Romney, naturally, as a Republican, took up this idea and he moved it in Massachusetts. And so one of the ironies is that the right wing in this country is opposed to the ACA, and yet it originally came from the Heritage Foundation. My final comment is this. There's a lot of talk about the website that's problematic right now. It will be fixed. We have been waiting for some 80 some years to get health care reform. Back when Medicare Part D was first enacted by George Bush in 2003, they had all sorts of computer problems when they were marketing that program. So this is not unusual. It will be fixed, and this doesn't detract from the fact that this law has proven to be effective in Massachusetts, and every indication points to the fact that it's going to be incredibly successful this time. So you have to take the longer view. We have to get beyond the short term and look to the long view, and it's going to work.